Welcome to the walkthrough of the FMLA Certification of Healthcare Provider form, also known as WH-380-E. This is the document that your doctor fills out if you're requesting FMLA for your own serious health condition, including mental health conditions such as depression, anxiety, or panic disorder. Our focus today is mental health and how to help your provider fill out the form correctly because vague or sloppy answers lead to denials. Quick disclaimer, I'm not a lawyer or a healthcare provider. This is educational support to help you feel less overwhelmed. It is not legal advice. Before we break this form down line by line, here's the best case scenario of where you should be in the process. Step 1, you've spoken to your provider and they've confirmed they're willing to complete the FMLA and short-term disability paperwork if you need it. Step 2, you've confirmed with HR that this is the correct form, the WH-380-E. Step 3, check and see if HR filled out the top portion, Section 1. If Section 1 is not filled out by HR yet, ask if you should wait or submit the provider section first. Some administrators require Section 1 completed before accepting the rest. You can still bring or send the form to your provider to complete the rest. Also, very important to note, if your employer uses a third party like MetLife, Sedgwick, or Lincoln, the form may look different. The questions are very similar, but you'll need to use their exact version. Ask HR to be sure. Be sure that your name appears at the top of every page of the form. And this leads us into Section 2, Healthcare Provider Certification. This is where your provider takes over. Now, you're allowed to assist them in understanding what to include. Question 1, approximate date condition began. This can be the first date you notice symptoms or missed work, but it doesn't have to be exact. Just make sure it's consistent with what you told the doctor in the appointment and what they're putting on the form. That way, if it's on your medical records, it matches. Question 2, estimate of how long the condition will last. This can be in weeks or months. However, writing unknown often leads to rejection. Ask for an estimate here from your doctor, or make sure you discuss the expected duration during the appointment. Question 3, the doctor is going to check all that apply. For mental health, the most appropriate boxes are usually incapacity plus treatment and or chronic condition. One thing to note here is permanent or long-term should be used cautiously. That box can sometimes flag for long-term disability consideration. Bottom line is to discuss which boxes fit your situation. Your provider should choose based on clinical judgment. Question 4, medical facts related to the condition. Writing anxiety or depression alone won't cut it here. And very important to note, you do not need to include a diagnosis. And in some states, providers are discouraged from doing so. Instead, focus on functional limitations. The best thing for the doctor to write here for confidentiality purposes, but also meeting the requirements for approval, is patient is unable to perform essential job duties due to a serious health condition. Also seen doctors be a little more specific here. Another example is patient experiences intrusive thoughts, fatigue, concentration issues, and panic attacks that impair ability to complete work tasks. Question 5 asks about planned treatment dates. So you're just making sure the doctors put all upcoming doctor's visits related to your condition here. Question 6 is if they've referred you to any other providers. If it's your primary care physician that's filling out this form, definitely have them list any specialists they've referred you to or that you're already seeing, such as a psychiatrist or therapist. Now, if you're applying for continuous leave, your provider can skip questions 7 and 9. Those only apply to reduced schedule or intermittent leave. Continuous leave means you're taking full days off in a row for a set period, 4 weeks away from work completely, as an example. Therefore, you don't have to complete those other questions related to partial or occasional absences. For more about intermittent leave, check the next training, Intermittent Leave Explained. It's kind of a beast on its own with landmines to avoid. So question 8 is what we're going to focus on. Your doctor is going to mark that the patient will be incapacitated for a continuous period of time. And then writing the best estimate for the start date and end date. And double check these dates, make sure they match. If you're already off work, make sure the start date matches the first date you missed work. On to Part C, essential job functions. This section asks, can the employee do their job? Here, your doctor needs to use language that matches your actual role. If your employer did fill out Section 1 of the form, then the description of essential functions and what your limitations are related to those. So I have examples listed here. I'm going to actually read off some that are just worded slightly different so you can kind of get a variation. Cannot maintain concentration for required 90-minute focus sessions. Unable to attend large staff meetings due to severe anxiety. Sleep disturbance impairs ability to complete time-sensitive deliverables. Never exaggerate or misstate symptoms. Your provider must complete this using their clinical judgment and in their own wording. Use this list to explain impact, not to script their answers. All right, that leads us to the last little piece where your doctor will sign and date. Half of rejections are due to missing signatures, unreadable writing, or incomplete sections. So always double check before submitting. And on the topic of submitting your form, HR or your leave administrator should be telling you how to submit. Whether you are uploading to a portal, emailing it to HR, or they want it faxed or emailed directly from your provider. In any regard, don't submit until it's signed, complete, and accurate. To recap, here are the common denial reasons. Leaving answers blank where applicable, writing unknown or indeterminate for everything, contradicting answers such as can't work, and then later on the form it says no functional limitations, no specific dates or frequency of treatments, forgetting to include your name on pages 2 through 4. Vague medical language or unsupported claims. All right, you made it through the walkthrough of WH-380-E. The next video will walk you through intermittent leave, which is common for mental health conditions and can give you way more flexibility. You've got this. And remember, vague forms get denied, but clear, honest ones get approved.